Can you explain why dental care is important in the overall, in one's overall health?
Through you, Madam Speaker, thank you very much for this question. To the good representative from the 81st District, we know from the research that people, especially as they age, their dental health becomes one of the key indicators of their overall health. So when people have declining dental health, their nutritional status declines and their ability to manage any disease that's related to nutrition declines. So their risk of infection gets significantly higher, and their ability to maintain health and well-being, it reduces risk of diabetes to have better dental health and cardiovascular disease. And so we know that for veterans, they're at particular risk if they're not getting adequate dental care, but they think they're being covered well by healthcare otherwise, that their dental health will be neglected. And we believe that this bill addresses a lot of those concerns. Through you, Madam Speaker.
Representative Poulos.
Thank you. That makes a lot of sense. I appreciate that the detail. I have another question regarding the bill. In my research on the dental component of this bill, I have calculated that we have approximately 157,000 veterans in the state of Connecticut, 3% of which do not have dental coverage, which would be just under 5,000 veterans that would be serviced by this dental proposal. Can you share, through you, Madam Chair, the fiscal impact of providing dental services for these less than 5,000 veterans in our state?
Representative Foster.
Through you, Madam Speaker, the impact to the general fund of this program is zero. This legislation uses an existing allocation in the Soldiers, Sailors, and Marines program, which allows for dental care coverage for veterans. It creates a $1 million cap under that program for the provision of that fund for dental care services for veterans in need of dental care. So no more than $1 million from that fund can be distributed a year for the purpose of this program. And the cap per veteran is a $3,000 cap. We also know that although there might be 5,000 people who are interested in participating in this program, the Soldiers, Sailors, and Marine Fund has participation requirements which will be enforced, so we believe the number who can participate will be smaller than that total number. Through you, Madam Speaker.
Representative Poulos.
Thank you very much for that fiscal clarification. I'll just conclude with a comment and observation. We have a history in our country of not leaving any of our soldiers behind. And I believe that this legislative proposal to providing dental care for our veterans does just that. It fills a gap where we have previously left people behind. And with this component of the bill, we will be providing for the underserved and unserved eligible Connecticut veterans an important health care need. Thank you, Madam Chair.
Thank you very much.